Hospitals and Social Services Committee. We're going to call it to order now. We have enough to begin. The first resolution is 1697 Vircher and Gilmore. It accepts the Healthy Start Initiative, Eliminating Racial and Ethnic Disparities grant from the U.S. Department of Health and Human Services to the Metro Board of Health to provide a variety of services in reducing infant mortality for pregnant and parenting women. May I have a motion?
Motion. Second.
It's been moved and properly seconded. We have discussion.
Madam Chairman, members, we have a treat this evening. Dr. Wendy Long, the new Director of Health, is going to explain this one because she handles the hard part and I just pick up the rest of the pieces. Yeah. So we wanted to come down and say hi. And so
thank you. Well,
I guess we need to appropriate.
Yeah, that's right. Congratulations. Yes, congratulations.
Yeah.
Thank you. I really am pleased to be here today and look forward to getting to know all of y'all and work with you more closely.
Yes.
And I have something exciting to talk about my first visit here. This item is a over $5 million grant that
Wonderful.
We're receiving from the federal government. It'll fund services over a 5-year period. The project that we're going to be funding, we've dubbed the Nashville Strong Babies Project. It basically targets 7 zip codes in Nashville that have the highest infant mortality rate. And the goal of the project is to try to, through case management and home visiting and some innovative clinical and community programs, to try and reduce the disparities that we see in infant deaths between racial groups and ethnic groups. So it really grew out of a much smaller project that we implemented back in 2016 that was in the Napier Sudicum homes, where we worked with 30 families and had just tremendous results with all babies living to celebrate their first birthday. And so this is going to allow us to replicate that, serving 700 families a year over a 5-year period.
That is exciting. Are there any questions? No questions about something so exciting that touches 5 zip codes to eliminate 7 disparities?
She didn't lead us any questions to ask. Yeah.
We do have a question.
Sure, go ahead, Councilman.
And I may have missed this because I was late coming in, but can you share what the criteria were for being assigned or picking those specific zip codes? Did I miss that?
It was an analysis of the infant mortality rate. So these are the 7 zip codes with
Did you
the
notice
highest
Belleville's in there?
infant mortality rate.
No, I did
Didn't
not.
you say 37221? Isn't that what you read off?
37115, 207, 208, 210, 216, 218, and 221.
That's what I thought.
Yeah. So, like, we at one time had the highest infant mortality rate in the United States. I thought we were like competing, like I said, like of those of emerging countries. I don't think they
A
call
couple of
it.
years ago.
Yeah, that it's been longer than that. It's been coming
Yeah,
down
I think we've
pretty
made a lot of
steadily.
progress since
So
then.
where are we now?
Etheridge, why, she was working on that quite a bit.
Yeah.
And did some.
It's right now, I think these are 17 numbers maybe. It's about 15 per 1,000 live births for African American babies and about 5
That would be
roughly
about right.
for Caucasian babies.
Okay. Where are we in
And they're
the?
both coming down, but that gap has remained pretty
Yeah. And
intractable.
where are we in as it relates to other states and stuff? If you said.
I'd have to look. It's not as bad. It's not that bad, but it's not anything above 0 is not good.
I think we're in the better half relative to other communities in Tennessee. And of course, Tennessee is not leading the country.
And so with those zip codes that were identified, how does that work, or is it up to the RFP? But do we have some like general guidelines on how that will look for each specific zip code?
So what we'll be doing is when individuals become pregnant and realize they're pregnant, what most folks do is come to the health department in order to get what's called presumptive eligibility, and we enroll them in TennCare. And so we have outreach workers at all of our clinic sites that will help a pregnant woman enroll in TennCare, and it will be at that point that we'll offer enrollment in this program to those individuals if they live in one of these zip codes.
Good deal. I know when we were in Ohio some years ago that they actually had persons that went out into the community, that were assigned to those communities, that they actually worked with the people in the community, and they said they really saw a decrease. Like they actually assigned people that were unique and specialized for that particular community, and they really saw a significant difference in their infant mortality rate.
And that's really the basis of this program. So the pilot, if you will, it wasn't really a pilot, but the small project that was conducted back in 2016 in Napier-Suticum was all about folks just going out and becoming a part of that community and getting to know folks, develop those trusting relationships.
So they will be going out into the community outside of being inside of the clinic?
Yeah, there's a home visitation component to the program. Yeah, so everybody who's enrolled will have a care coordinator, and part of what that care coordinator will do will be to make home visits.
Good deal. And then I had shared with Mr. Sharp, I had read inside of the grant too that they said that it should be reflective, like of who it's servicing.
Absolutely.
Yeah. Okay. And so I guess just give us an update. But that's really exciting. Are there any more questions or talk? All right, so we're ready to take a vote. All right, seeing none in objection, it is recommended to the full body for approval. All right, and we have everyone is present and accounted for. How exciting.
See what happens when you chair the meeting?
No, it's not me, Paul. It's not me. It's you guys. It's you guys. Okay, so Resolution 2019-1698. It accepts a grant. The sponsors are Virtue and Gilmore, accepts a grant from the Save Coalition to the Metro Board of Health to provide funding for Metro Animal Care and Control Safety Net Voucher Program. May I have a motion?
So moved.
Second.
It's been moved and properly seconded.
This is $5,000 for folks that bring usually a dog in with either a health or a behavioral issue, and they can't afford either the veterinary care or the training to keep it. And if they bring it in and say, I can't handle this dog, would you put it down? We say, well, what's the problem? And if it's just wetting the rug or if it has a heartworm or whatever, this gives us another option to try to treat that so that they don't have to do that.
For dogs that don't behave, bad doggies.
You'd be surprised. Some people, most likely, most of these will be ill in some fashion.
Okay, yeah, the illness.
We might have a broken leg, it might run in the driveway or something.
You're not sad. Not the one that just urinates on the carpet just because, or bites the neighbor in the leg when you tell him to. That neighbor's gonna say,
Or eats your red shoe.
yeah, eat your shoe.
Oh, wow.
I do.
Somebody knows.
Today is my dog's 5th birthday, so I just thought I'd throw that out there.
Oh, happy birthday,
Chance!
Oh, happy birthday, Chance.
Well, I told
I do
my
have a
husband to get
question.
rid of the dog today.
In the event of a mental health issue or a training issue, who do you farm that out
I
to?
think they farm those out. We have vet techs that come in through rotations pretty often. You guys see those contracts when they come through the agreements. And I think we have an agreement with Animal House to help that. There are some vets around that will help. They may even be volunteers, to tell you the truth, I'm not sure. Because there's a lot of folks that volunteer to help out there.
Any of the rescues? Any of the rescues?
It may be. I'm not really sure who they are, Sherry. I can find out for you who we farm them out to. I suspect most of them are medical issues.
Heartworm is a biggie.
Yeah.
Oh, that's good.
It's treatable, but it's expensive.
That's good. Bad doggies need a place to go too, because I know we sent my doggy to school and he ended up with a certificate, but he learned nothing. They just passed him through the system. But oh well.
I've got a son like
I had
that.
a Dalmatian that said it was a pretty house, but nobody was home.
Mental health professionals for dogs.
Yeah.
How many dogs get turned in a month on average?
That is 1,000th of the amount of money of the one you just voted on before.
Yes, how many dogs get turned in a month? So
Oh,
owner
heavens.
surrenders.
Owner surrenders is a surprisingly high number. It is the largest source. It's more than we pick up on the streets running around. It's somebody will get
Too much
transferred
dog.
or they move into another apartment that won't take animals. It's a surprising number. I don't know what he did exactly, but it's the largest single issue.
My census is down from 5.
But I think we've made some progress, because it used to be, I think we accepted owner surrenders, no questions asked, and now we really do try to
Right.
see if there's anything that we can do to maybe
We manage
allow
it
that
now,
family to
yeah.
keep the dog.
It seems like it was the first year of this council term that we were able to add a person on staff that manages this. And so that's somebody that's actually there that for this reason. So it was something that I know that Mayor Barry supported her first year. So
And that individual is now on the board of Friends of MAC, who raised money for us. You'll see grants come through for them occasionally.
All right. See no further oh, yes.
I'm voting.
Oh, you voted?
you voted yay.
No, you are jumping the gun. Seeing, I was going to say,
He's a
seeing
ref.
no
He goes
further
quick.
discussion.
I'm already.
Yeah, yeah.
Touchdown.
Yeah, I know, right? All right. So 8 for, none against is recommended to the full body for approval. All right, Ref. All right, next one.
Like he's trying to arm wrestle me.
I ain't gonna do that with you.
Resolution 2019-1699. Sponsors Gilmore approves an amendment to TWO to TO, a grant from the March of Dimes Foundation to the Metro Board of Health to promote increasing preconception and interconception education for women of childbearing age in Davidson County. May I have a motion?
So moved.
It's been moved and properly seconded. Is there any discussion between the TWO and the TO?
I'm not going to get a, no. You saw this about 2 or 3 months ago. This was a change at the state level of the counseling approach in the family planning clinic. They went from the one key question approach to this PATH approach, which is an acronym that eludes me. But because that period, that grant period has run out, that we're just renewing this again. There's no money involved in this one.
Yeah, two. What's the preconception and interconception? What's the difference?
Preconception would be someone who's never gotten pregnant. Interconception would be somebody who's just had a baby, and you're providing family planning services to try and have optimal birth spacing.
Okay. Oh, okay, between
Pregnancies.
pregnancies. Okay.
Yeah.
Wow, that's
Actually has a
interesting.
pretty big impact on birth weight, infant mortality, and things.
Okay, good deal. And how does that work? I've never even heard of that. Like, we specialize in that as a government. We're helping people with this.
Well, we help people with family planning. I mean, we're available to provide all sorts of birth control methods, and you know, one of the things that we can certainly counsel folks on is the optimal time period to wait to get
Gotcha.
pregnant.
Now, do you talk to the men too, or just the women?
Well, if you can get the men in, we'll talk to them. But it's a little harder than
Good deal.
getting the women in.
I didn't, it doesn't show a dollar amount on here. Did you mention that?
It was
You did.
Just extending the contract term, there's no dollar change.
You had something?
I was just going to say that I did that when I was a CASA volunteer. I didn't realize that I was doing
Conception.
conception counseling and all that. I didn't realize it had an appropriate name for it.
I mean, this
But I was very effective.
Chair, this is being recorded. What is the optimal time in between?
Well, it depends how many children you already have
Right.
and on other sorts of circumstances, but typically you want at least a year, if not 2 years between pregnancies.
Say that on video.
I think that's
For
important. Thank
a
you.
mother that's had 3 all within like 3 years time period, I can tell you for sure. Yeah.
It wasn't optimal.
Yes.
May the force be with you.
Yeah. I think, it's a lot to that, though, for women, without getting too down in the weeds. You know, clocks, timing, just all those things. But anyway, so it's a good thing. I didn't even know we did that. So we're ready to vote?
Yeah.
All right. Everybody's for 8. Seeing none against is recommended for approval. Optimal time, a year apart. A year, 2 years. All right. Resolution 2019-1700 sponsors Vircher and Gilmore. Accepts a grant from the Tennessee Department of Health to the Metro Board of Health to provide chronic disease prevention management services to reduce risk associated with prediabetes, type 2 diabetes, or heart disease and stroke. May I have a motion?
So moved.
It's been moved and properly seconded. Discussion?
You will see this one again fairly shortly. It shows on your sheet, I think, is $151,000 for 3 years. That's going to go to $60,000 per year over 4 years. It'll be a staff member at the health department who will liaise with General Hospital, Neighborhood Health, Matthew Walker, and the libraries to try to get folks with untreated or prediabetes or untreated hypertension or diabetes into clinical care.
So now how will they identify those people? And it just seems like there's so many people just for one person, even though they're partnerships? How does that look?
They will be referred to us. We know a lot, the survey that we're doing now is giving us a pretty good idea of where folks are.
And what survey is that?
The Health and Community Wellbeing Survey.
Okay, I just wanted us to be specific. I thought
That's
that's
one
what
of
we
the
might
things that
refer.
we learned from that. We're learning from that.
Okay, first.
And that doesn't preclude those other partners from doing the work that they do on an
Right, and there's some
everyday basis.
educational
This
materials
is
and
just
so
to
forth
have them
involved
serve
in
as a
this.
liaison.
Did you say this was for 3 years, this 150?
Right now, it says it is. It's going to come back at 4 years at 60,000 per.
Our analysis tells us this is a 4-year deal.
Oh, does it say 4? Well, my bad. It's going to be 60,000 a year then. It's going up.
That'll be more. Good.
Yeah, that is. Are there any more questions, comments? All right, so we're ready to take a vote? All right, seeing none opposed, it's recommended for approval to the entire body. All right, so the next one is Resolution 2019-1701, sponsors Vercher and Gilmore. It approves an Amendment 1 to the grant from the Tennessee Department of Health to Metro Board of Health for Healthy Start Home Visiting Program to identify and provide comprehensive services to improve outcomes for eligible families who reside in an at-risk community. Do I have a motion?
So moved.
All right, and I know yesterday you asked, what is eligible, council member? Did you want to ask that?
Would you please answer that question that you so
So,
eloquently
you wanna-
shared with me
you wanna
earlier?
handle that? So the eligibility is established in a survey that's put together by the Healthy Families America. It's an evidence-based, fairly strict survey on how it asks you a bunch of questions. I'm not sure exactly what they are, but they give the clinical worker a way to assess whether there is an elevated risk of neglect or abuse or some other bad things happening in that family. And they can then refer them for this program. It's an evidence-based home visiting program. We call it Healthy Beginnings to differentiate it from the first one you saw. We'll have 4.5 folks that are working on this. They will go out and see. Let's see. One of the things this does is extend the grant period and change the term to put it on the federal fiscal year, so it's really 2.25 years worth, and it raises the funding a little bit, and the caseload goes from 52 to 70 cases a year. So it's a relatively small cohort, but it's a very labor-intensive interaction.
So have they been, so you have lots of information and data on it now about these?
Yes, we've been doing this for a while.
It's a federal program. It's been extensively studied, and if you are selected to receive these funds, you have to promise to implement the program exactly along this model that has been studied and proven to be effective. And it's very much focused on preventing child abuse and neglect.
So what happens after you refer? I apologize. Go ahead.
No, sorry. Go ahead.
I was just going to ask, so what happens after you refer? I asked this question yesterday, and I think you said you may refer them to, was it DCS or DHS?
Oh, that was, so
this something
if there
different?
is actually abuse,
Yeah.
that's a different issue. That would be referred, I would think, to DCS.
Okay.
But what this program does is basically assign a home visitor, case manager who works extensively with the family, lots of home visits in the course of a year. But yeah, if the question was, if at some point in the course of that, do you see signs of child abuse or something, then like anybody, there would be an obligation to report.
Yes.
I do have a question about the federal program. How long has it been around, and what kind of statistics do they have that show that this is extremely effective?
It's been around for decades.
Has it?
And we could provide you with all kinds of studies. That's why they're so adamant about you having to implement their model, because
Yeah, I just wondered
lots
how
of
much-
folks, there's a lot of data out there we'd be happy to share.
And I guess too, and this is the last question, it kind of ties in, but it doesn't. There's the overall measurement that they do, and I think it's supposed to be coming up 2020 for healthy, is it called Healthy People or something that the federal government does for each?
Those are set by decade by the CDC.
Okay.
Their goal. They're pretty aspirational.
Okay, so where are we and how do we tie in with that?
So typically those set goals for the country around just about everything that you can imagine that could be considered a health issue. And I honestly, 2 months on the job, couldn't tell you where we stand relative to all
Because
of those.
I thought it kind of drill down into each region as well, each like demographic.
Yeah, and there are certain grants that we have that set that as the standard that you're shooting for.
Okay.
Not all of them do specify that particularly. We're aware of them. There's really, when you see those come out there and they're assessed in the health department, there will be very little that's surprising as a general rule. I mean, we kind of know what the problems are. But they will set, we want to reduce the infant mortality rate from here to here. We want to reduce diabetes from here to here, hypertension from here to here, untreated diabetes from here to here, that kind of thing. I mean, they're all good things that give you a roadmap toward the sort of universe of things you want to work toward.
Yeah, but you know that this region is the sickest because of the poverty that we have and experience and the bad habits and all of those things. Other states and regions are a lot more progressive than what we are, so we have to catch up. But the poverty is probably the biggest thing because that drives the poor eating habits and the lack of exercise and all of the things that builds a quality of their life.
Agreed.
All right. So I guess we're ready to take a vote. All those for? See, now the case is recommended for approval.
Go ahead.
Okay. The next one. This is Resolution 2019-1702. It approves a contract between the Metro Board of Health, the University of Tennessee College of Social Work to participate in and review the organizational resiliency assessment.
So moved.
Thank you. Moved and properly seconded. We're ready for discussion.
There's no money involved in this one either. So the UT College of Social Work has put together a resiliency assessment tool, organizational resiliency assessment tool, and they want to get a clue whether it works or not. So they're going to come to us and survey our staff and try to, really they're testing out the tool as much as they're trying to figure out whether we're resilient, although we should find out in the bargain.
Okay. Well, let us know what happens if they find out you're not resilient. I'm sure they're going to find out that you are resilient.
It's a 1-year contract, no cost to us. No cost, just go with it.
All right. So we're ready? If there's not any more discussion. Okay, yes. All right, seeing all in favor, it's recommended to the full body. Okay. Last one. Resolution 2019-1703 sponsors Gilmore approves an agreement between the Metro Board of Health and the Food and Drug Administration to participate in a long-term food, feed, and cosmetic information sharing agreement. May I have a motion?
So moved.
Moved and properly seconded.
This is my favorite one of the day. We found out a couple years ago there was a multi-state outbreak that started in Alabama from a food processor in Alabama, and the food came here in North Carolina. And our food guys got on the phone with the EPA in Alabama and I think Georgia too. And the EPA, or the FDA said, sorry, we can't talk to you. You don't have this confidentiality agreement.
Oh.
So we said, well, thank you, and got off the phone. Then we called Alabama and said, where'd the food go? And they told us, but we'd rather not have to do that. So this says if we find out about this, we won't blab. We won't. It's a
Very
confidential.
important, though. It's very important.
It is, absolutely, and we need to be able to know that information. No
Definitely.
question.
Definitely. Is there any more discussion or questions? All right, we're ready to take a vote. Seeing all in favor, it is recommended for approval. This is our last one. Once again, we want to thank you, Dr. Long, and welcome you in your new position. We look forward to working with you as the Health and Hospitals Committee. Would anybody like to?
I just wanted to mention the stakeholder plan that came out of Meharry. I would like to recommend that the Health and Hospitals Committee write a letter of support for the plan so we can move forward with it, and based on some of the things that we were talking about, especially with the diabetes and hypertension and all of those ills that are prevalent in our communities, especially the North Nashville community, that we move quickly to make sure we don't lose the momentum of what was transpired with that stakeholder committee.
Sounds good.
I just wanted to ask, where is the hospital with the stakeholders'
So
information?
we need to get a motion.
They completed the plan, And they
I know Meharry did, but the hospital, what is the hospital?
it was all inclusive.
Okay, all right,
Yeah, it was
yeah.
an all inclusive. They had stakeholder people from the community, from the hospital, from Meharry, and all of that.
Okay, so we got a motion. Do we want to entertain the motion at this time to send a letter of support for the recommendations made by Meharry? Okay, so it's been moved and properly seconded. All in favor? Aye. Seeing none against, this concludes our meeting. Thank you so much. I appreciate your support.
By the way, Mark Overlock